What's up, everybody? I am talking about cannabis research today, and really, research is the cornerstone of science. We use research to guide us in everything we do, and that really should be no different when we're discussing the health effects, both positive and negative, with cannabis consumption. So, research is complicated, and this is just going to be a summary of some of the ways I think about research and kind of how I hope you'll incorporate these themes as you review research in the future or just look at articles in the lay press that are interpreting research for you. First, I want to just dispel a myth that's commonly stated repeatedly. And what I hear all the time is that we have no research on cannabis. That's common in articles. People will talk about cannabis and they'll be like, well, we don't really have any research, so we don't know. Doctors talk about this all the time, saying, no, I don't look into cannabis because there's no research. So I just want to kind of comment on that. First, PubMed is the primary database we use for research articles, pubmed.gov. And so that's often the first place you go if you want to search for research. If I do a search for on PubMed for cannabis, marijuana, or endocannabinoids, I get back almost 56,000 papers. Okay, that's a lot of research. Just to give you a comparison, if I do a search for Tylenol, a very common, well used over the counter medication, I get about 34,000 research articles. If I do a search for Advil, another very commonly used over the counter medication, I get about 17,000 articles. If I do a search for Benadryl, which is an antihistamine, something people use for allergies, I get about 7,000 articles. So just to give you a sense, there's more articles on cannabis, marijuana, or endocannabinoids than there are on three of the most commonly used over-the-counter medicines combined. So let's be clear, we have lots of research on cannabis. That doesn't mean we have enough. Definitely more research is necessary, but we still have a strong base of information about how cannabis works and why it might provide both risks and benefits. And so we can kind of use that research. The bigger challenge is really how do we interpret the research that we have, and then how do we make both individual health decisions and public health decisions based on that research? And that's a question without specific answers. And this video is, again, going to explore some of the challenges and then hopefully force you to think critically about the research you review or that you read about. And there are kind of 5 topics I want to stress in this video that I think are extremely important to consider as you try to understand cannabis research. First is the impact of prohibition and the restrictions and regulations that have been put in place, which limit how and what we can study when it comes to cannabis. Next is simply the complexity of the cannabis plant and the complexity on how we consume it. Next are biases that occur when we're either creating or reviewing cannabis research. Next will be this important difference between causation and correlation. And kind of one piece of that difference between causation and correlation is the impact of placebo effects. So those are kind of the main topics we're going to talk about in this complexity about how we understand cannabis research. So as we talked about during our criminalization and prohibition section, cannabis, as of this time, is still a Schedule I status drug in the United States, which means it is highly, highly restricted. It is very difficult to get access, often takes years to even get a study started to go through all the hoops necessary to research with actual cannabis product. You certainly can't just grab stuff at a dispensary and study those items with patients. So one big take home of this is that we don't typically have good research with the studies. We don't have good research with the products that most people are consuming. So that's, again, one of our limitations when we look at the cannabis research that's out there. Again, a big take home that's not typically research on what people are actually consuming on a regular basis. And we have to recognize that there's so many regulations and restrictions. A lot of the research we might otherwise want to do or we expect might be there that give us information just isn't necessarily available at this point. Another important concept on how we look at research is the complexity of cannabis. We simply cannot generalize when we're talking about cannabis. Cannabis is a plant with over 400 different constituents. So studying cannabis is very different than when we're studying just a single molecule, like Tylenol, for example. That molecule never changes. It's easy to study because you give certain people Tylenol, you give certain people nothing, and you can see the difference. But when studying cannabis, that means a whole variety of different things. It means completely different combinations of constituents. Are we studying THC by itself, CBD by itself? Are we studying products that have both THC and CBD in them? And then not only THC and CBD, there's all the other different constituents, cannabinoids, terpenes, flavonoids, and so on and so forth. So there's a wide range of different constituents we have to think about. We can't compare one study to another. There's just completely different products. Two different products might have similar amounts of THC and CBD, but again, there might be other types of ingredients. So it's really, again, hard to compare the results of a study with one product to the results of a study with another product. So anytime you're evaluating a research study or any claims based on cannabis, you have to ensure you have a complete picture of what they were actually looking at when they said cannabis or meant cannabis. And often they don't tell you. Sometimes you look for that in a study and that information is not gathered. For example, if we were to do a survey of 1,000 individuals that use cannabis, a large percentage might say they suffer from cough. And therefore you might conclude, oh, the research says cannabis causes cough. And that research, if they actually took the time to break down how people are consuming, you might find that, oh, well, actually only those that are inhaling get a cough. And cough has nothing to do with cannabis itself, but rather the method of administration. So just to reiterate, to make any conclusions about a claim or a research study, you need to know what constituents are actually being evaluated and what are the routes and methods of administration. Furthermore, you need to know what's the amount or the dose being used and how frequent is it being consumed. Because as those factors change, you're going to find very different conclusions. For example, if you're studying anxiety, you'll typically find small amounts of CBD don't do that much, but larger amounts of CBD might help significantly. You'll also find smaller amounts of THC might reduce anxiety, but larger amounts can cause anxiety. So just this is a simple example of why you can't make a general statement like cannabis is good for anxiety or cannabis is bad for anxiety. You need to know the specifics of what's in the products you're talking about when you just say cannabis. There's a variety of biases, both in terms of what research has been done and how we interpret that research. So first, let's talk a little bit about what research has been done. The data on this slide is a little bit old now. This was written up in 2020 and looks at information going to 2018. But basically, someone took a look at all the cannabis research that was funded in the United States, in Canada, and the United Kingdom. And as you can see, that top line that kind of separates itself from all the other lines is funding on researching the harms of cannabis. And really, researching the harms of cannabis accounted for more than 50%, or at least 50% of the funding of all the studies being done. That tiny little bright red line at the bottom, that represents funding for research on the benefits of cannabis. And when you run the numbers, that means we funded 20 times the amount of research on the risks of cannabis versus the potential benefits of cannabis. So if you went to research cannabis or understand something about cannabis and all you see is research on the harms, you might conclude that, wow, cannabis causes a lot of harm, or really the only thing cannabis might cause is harm. And while that theoretically could be true, the reality is more likely that interpretation is due to a bias of what research gets performed in the first place. So we need to understand some of these biases on what kind of research gets done. Now, cannabis discussions are not just about whether it's safe or beneficial, but also whether it should be legal or illegal and to what extent. These are, of course, been very common questions over the last 30 years as legalization measures have taken place in the United States and in other countries. Now, we spent a week talking about the impacts of prohibition on public health, but are people actually researching this? And the answer is pretty much no, based on the conclusions of this study. And again, in this study, they basically concluded that prohibition-related health risks go unacknowledged and are unaccounted for in biomedical research on cannabis. So again, when we're having this discussion that we say is based on facts or based on research, whether cannabis should be legal or not, we have this huge bias where the bulk of the research only looks at harms of cannabis, and there's minimal to no research on the benefits of cannabis or the harms of prohibition. Now, beyond the biases in the research that's available to use, there's a variety of biases with how we utilize the research that's out there. And there's one area of bias called confirmation bias that I want to touch on. Confirmation bias is where we just look at the evidence out there that supports our current beliefs, and it ignores the other research that's available. So for example, if I already believe cannabis is helpful for pain, I can find a variety of studies that support that view. However, there's also going to be studies out there where the results showed cannabis did not help pain. Confirmation bias is when I kind of ignore those negative studies or don't even bother to look for them or read them and just use the small sample of research that confirms my existing belief. Now, this positive cannabis bias is becoming more common as media, messaging, and personal experiences are highlighting potential benefits. So we have a lot of people that really believe cannabis is valuable and beneficial, and sometimes they're only going to look at or talk about the research that kind of confirms that belief. And again, we want to broaden that. We want to look at all the research available. Now, of course, confirmation bias certainly happens in everyone, regardless of their beliefs. And when it comes to cannabis, think about what's been the default underlying belief for the majority of people for most of the last 100 years. Well, as we talked about again in week 2, that default belief has been that cannabis is evil or that cannabis is dangerous because we had this highly effective propaganda campaign which created stigma against cannabis and its consumers. Now, certainly those views are breaking down, but one, they're still common, and two, they're especially common amongst politicians and medical professionals who are the ones that create the guidelines and the policies, as well as the ones that fund and perform the research. So confirmation bias is rampant in cannabis. We have this long-standing history of people believing that cannabis is evil. So then when they look at research, they tend to focus on the research that kind of proves their belief that cannabis is evil. And as I said before, that research tends to dominate what's available to look at in the first place. Now, as we get more into modern times, we have this large group of people who really believe cannabis is valuable. And we want to make sure we don't kind of cause the same mistakes and just only look at the research that confirms our beliefs. So confirmation bias is huge and something you want to interpret when you're reading research yourself, but also when you're reading how other people are interpreting research. Try to understand what's their bias, what's their agenda, and what kind of preconceptions do they come with.
Ah, not a bear in sight. The Bear Patrol must be working like a charm. That's specious reasoning, Dad.
Thank you, honey.
By your logic, I could claim that this rock keeps tigers away.
Oh, how does it work?
It doesn't work.
Uh-huh.
It's just a stupid rock.
Uh-huh.
But I don't see any tigers around here, do you?
Lisa, I want to buy your rock.
So another big theme when interpreting cannabis research is to understand the difference between causation and correlation. Now you have a resource in the additional resources that discusses this in more detail because I think it's pretty important. But I also believe if you want to understand an important topic, you go right to the Simpsons, who have been creating social commentary for many years. So I hope you enjoyed that. But just because two things are related or happened kind of together at the same time doesn't mean one causes the other. This is just a really simple example that shows ice cream sales and shark attacks increase and decrease together throughout the year. But that doesn't mean ice cream causes shark attacks. There's this big issue that we call confounding variables. So in this example, the confounding variable is hot and sunny weather, which causes people to both eat more ice cream and go to the beach where shark attacks tend to occur. So this confounding variable causes ice cream sales, and shark attacks to correlate with each other, meaning occur in a similar fashion or at the same time. So to give you a cannabis example, there's been many studies that consistently show there's an increased rate of cannabis consumption in individuals that have depression. So some people might interpret that as, wow, cannabis causes depression. More depression equals more cannabis use, therefore cannabis causes depression. Other people might interpret that as cannabis treats depression. More depression, more cannabis use, therefore most people are using cannabis to treat depression. Again, the relationship between depression and cannabis use is just a correlation. It doesn't show whether cannabis is causing it or helping it. And we see a lot of this in cannabis research. We see a lot of what is called observational research. Observational research is basically when surveys are taken by individuals, or the effects on individuals are looked at after they're given access to cannabis or that consume cannabis. And this is important research that absolutely gives us clues and guidance, but doesn't prove cannabis causes whatever outcomes they find in this observational research. Just because in a survey of patients consuming cannabis, 80% say their pain is better, that's not necessarily proof that cannabis was the reason their pain got better. Likewise, there might be a survey of teens that went to jail, and that survey might show higher rates of cannabis use amongst teens that went to jail versus teens that didn't go to jail. Again, that's just a correlation. It doesn't prove cannabis causes increased criminality or arrests. You have to understand what confounding variables might be present to cause two things to move in a specific direction. There's one very big confounding variable that plays a role in a lot of cannabis studies, and that's what we call the placebo effect. In a nutshell, the placebo effect means that an individual's expectations will have a huge effect on their results to a specific treatment. If someone expects the treatment to help, it's much more likely that treatment will help. And this is an extremely powerful effect. And we see this in research studies where half the participants get a placebo, a treatment that has absolutely no active ingredient. In most medical research studies, the groups that get this fake placebo treatment show improvements of 20 to 40%. It's an amazing result. Imagine if someone said, hey, there's something you can do that's going to reduce your pain by 40% or reduce your depression by 40%. You would want that treatment immediately. Okay, and we see those results with placebo because the placebo result or the placebo effect is so powerful. And there's, of course, many theories about the placebo effect, which we're not going to go into, But in general, when you have an expectation of benefit, that turns on a variety of healing pathways in the body that leads to actual improvement. It's not magic, it's just the power of your body's own healing mechanism. So there are many that think placebo effects are associated with some of the positive responses people report from cannabis therapy. And due to the restrictions I talked about earlier, most of the research on the effect of cannabis for certain conditions are what I mentioned previously called observational studies. This is where a bunch of patients with a specific condition are given access to cannabis and then monitored for their responses. And typically in these studies, there's a pretty overwhelming report of benefit. But since in these studies there isn't often a placebo comparison group, a group that did not get cannabis and got fake cannabis, for example, we don't really know if cannabis was the cause or whether it was just the patient's expectations that cannabis would help, and that's what caused the improvement. In research, we try to understand the true effects of a treatment and separate that from the placebo effect. And we do that by performing what we call double-blind, randomized, placebo-controlled studies. This is where half the patients get an active treatment, the actual medicine, for example, and half get a fake or a placebo treatment, and neither the patients or the people doing the research know which patients got what. Then you can compare the results of each group, and theoretically, there's the same expectation of benefit in each group because nobody knows what they're getting. And thus, you're going to look at in the results what additional benefits the treatment group received beyond whatever the placebo group received. And that's what we often call the gold standard for medicine research, this randomized placebo-controlled study. But again, the restrictions and the prohibition status of cannabis has limited our ability to do these types of studies, though there's definitely some of them, and many of these well-designed studies show benefits of cannabis. The other challenge is even when you randomize and give half the folks cannabis and half the folks a placebo, if you're using THC, THC causes a pretty obvious sensation. So even when you're trying to what we call blind patients, where you don't know what treatment you got, it's kind of hard to prevent those given THC to not know they got it. And so that can have placebo effects, making the benefits of cannabis potentially look better than they really are. So again, the placebo effect is just one type of confounding variable that can impact causation versus correlation when we look at research. So what can we do? Okay, I just talked about all this complexity and why interpreting and performing cannabis research is challenging, but that doesn't mean we just should screw it and say, yeah, we're not going to do any research because we don't have a definitive answer how to interpret it, and we certainly shouldn't just ignore it. What it really means is we have to think critically before making conclusions. And so I want to touch on a few things that I think that I do when I look at research, and I hope you guys will incorporate when you look at research directly, or at least when you're reading about how other people are interpreting the research. First step is don't generalize. Again, don't generalize and lump cannabis as just one treatment. You absolutely need to look into what someone means by the word cannabis or marijuana in their research. What constituents are they talking about? THC, CBD, both of them? What ratios? What other cannabinoids or terpenes or flavonoids are being talked about? What is the constituents that's being studied, or what's the product that's being studied? You also have to look at how much and how often folks are consuming cannabis in the research. What's the total amount of these constituents getting into the body? And importantly, how is that being consumed? Is it being inhaled or ingested? If it's being inhaled, or is it being smoked or vaporized? If it's being vaporized, is it being vaporized with a dry herb flower vaporizer, or is it being vaporized in a low quality vape pen? You can't generalize. You need to look into the details what someone means by cannabis when they're doing their research. You have to acknowledge biases. That means your own personal biases and those that are present in the field of research itself. So try to understand these biases that I talked about and really see how that impacts the conclusions you're trying to make. One way to limit at least your own biases is to review different opinions. This is super important to limit confirmation bias. Don't just look at research or articles that confirm the beliefs you already have. Thoroughly review opinions that are different from yours. Consider all types of research. It's common amongst doctors that I'll hear statements like, I only look at these double-blind, randomized, placebo-controlled trials, and if there's not one with cannabis, that means there's no proof. Now, these types of double-blind, randomized, placebo-controlled trials are extremely valuable. They provide great information, but they're not without negatives. And it's a little bit beyond the scope of this course to go through all the negatives and pros and cons of different types of trials. But again, looking at a randomized double-blind placebo-controlled trial is not the only way we can make conclusions. In class, I mentioned what an evidence-based medicine approach is. And an evidence-based medicine approach looks at all the different types of research available and then also incorporates the experiences of patients and clinicians and uses that whole body of evidence to make conclusions, as opposed to just picking one study and then extrapolating that as a one-size-fits-all approach to everybody or all types of cannabis. So really need to look at different types of research and use those to come to your conclusions. And then finally, define your goals based on what you're trying to get from the research you're looking at or that you're doing. So again, what research you review is going to vary based on what your goals are. If I'm trying to decide whether to consider cannabis for a specific patient that's sitting right in front of me, I'm going to look at this differently than if I'm trying to make public health recommendations for an entire population or even a specific demographic. Again, what's the goal? Am I trying to maximize the most individuals that might benefit from cannabis? I'm going to look at certain types of research or make decisions differently than if I'm trying to minimize any potential for harm. So just, for an example there, if I'm trying to maximize the benefit the most individuals might have, I might use observational data to say, wow, a lot of people with fibromyalgia seem to be getting benefit from cannabis. I don't have a lot of placebo-controlled studies, but I'm trying to offer the most benefit to individuals. So I'm going to push for people with fibromyalgia to use more cannabis. There's no 100% proof, but I'm going to interpret my reason that way because I'm trying to maximize benefit. On the flip side, if my goal is I'm trying to minimize harm and there's one or two studies that show, wow, cannabis might be harmful, I might use those two studies more and make decisions based on that because I want to minimize potential for harm, and I'm going to wait till there's more studies that show safety before I make a widespread recommendation to use more cannabis. So again, really define your goals, and that's going to change what research you look at and how you interpret it. So I think there's plenty you can do, even though cannabis research is a very complicated and confusing area. And I hope this summary gives you some help as you go forward, not just looking at research directly, potentially performing research, but more importantly, reading how other people interpret the research out there. So thanks for listening.